Well, one of us here at ASCO 2014 has rock star status, and it's not me. It's the man to my left, Dr. Nicholas Vogelzang. Thanks for stopping by again, sir.
You're welcome. Welcome to Chicago, my old hometown.
Yeah, your stomping grounds.
Right. Great to be back.
Creating a bit of a buzz this year.
Yes, yeah, it's been a good year. Again, prostate cancer looks to be again in the news. I thought when it couldn't get any better, it got better. The big news coming out of the plenary will be the role of chemotherapy earlier in the use of hormones. For years, all we did was surgically or medically castrate patients, and there's been no real major advances since the 1940s. And here we are, almost 65, 70 years later. Suddenly we have putting chemotherapy during the first hormone therapy. Bingo, life extension. I guess we should have figured that because that's what we did with breast cancer. We learned that giving chemotherapy early in breast cancer mattered, and it shouldn't surprise us that giving chemotherapy earlier in prostate cancer will improve survival. The big challenge with that study called Charted, being presented by Chuck Sweeney today, is that it's harder to give these older guys chemo. You know, they're older. I mean, they're in their 70s on average, and not all of them are wanting the chemotherapy. But that's a pretty big news, and that'll be number 4 on the hit parade. It's the 4th, there's 4 plenaries, so that'll be there.
As we sit here today, this is just written about in the New York Times.
Yeah. I was interviewed by the New York Times yesterday, and they really thought it was a pretty big deal. I had a nice interview with Mr. Pollack, and he sort of understood the importance. But when you think about a treatment that has been present for cancer since 1940, with no major advances in over 70 years, and now suddenly with adding chemo to hormones, we're extending life considerably. That's impressive. And it's not like a new drug, it's an old drug. So you teach an old drug new tricks, just like teaching me a new trick.
Right.
So it's pretty cool.
Let's talk about the other buzz with PD-L1.
Yeah, so the other big news is PD-L1, the amplifying effects of that drug have been shown previously in lung cancer and kidney cancer and melanoma. But we did a study in bladder cancer using the Genentech drug. I believe that Merck also has a drug similar to it, and a few others do. But Merck opened up in bladder cancer, and we were just in the right place at the right time. And yesterday, Tom Powles from St. Bart's in London presented to a packed house the results, and it showed that in 68 patients, about half had shrinkage or complete regression of tumor with virtually no side effects. I mean, literally no side effects. So when you are dealing with elderly, ill individuals who have kidney trouble, and you can get away with a drug that doesn't give you problems, it's a big deal. So I was telling them the story about one of my guys who fought against Rommel in North Africa and then fought for the Israeli army in the Israeli War of Independence. He's now 88, 89. Well, I didn't want to knock him off with chemo, and I didn't think I would, but still, he's a war hero. I want to keep him alive a long time. And he went through a whole year of treatment, and cancer's gone. So it's like, okay, I'll take it.
Right.
I'll take it.
Now, you've had advice, or you've had good fortune in working with older patients.
I have.
And you understand them well.
Yeah.
I use the term advice because that's what I was trying to get to. What advice do you have for some of your colleagues in just understanding how to treat these people, both for their diagnosis and who they are as a person?
Well, the key is to love them, to know them. to get to know them, to learn what is their story, what created them the way they are. Each individual is so unique, and you create stories like the guy who's jumped out of a plane over World War II and his parachute failed at the last minute and he hit a rock and got knocked out, and you hear these stories, you go, really?
You got to keep that guy around.
I know, and or the guy who used to sell shirts in New York City, he's on dialysis now. And I said, so what'd you do in World War II? He says, I shot down a kamikaze. I said, what? He said, yeah, I could see him. He looked at me and I looked at him, and it was either him or me, and I got him first. Okay, that's the sort of stuff you like to hear.
So the key is you spend time with them.
Oh yeah. I get home late, but it's fun.
Very good. Your own version of personalized medicine.
Absolutely.
Thank you, Dr. Vogelzang.
Thank you.
Best of luck. We'll look for you again.
It's great to be here again.
Okay.
Thanks.